I warmly welcome everybody to today's session on Dr. Rishiram Koirala Memorial International Webinar Series. This is the day for Sri Lankan expertise of the field to share their knowledge with all of us. I myself consider this as a great pleasure and honor to introduce these two outstanding personalities of the field to our discussion, Senior lecturers of Institute of Indigenous Medicine, University of Colombo, Sri Lanka, Dr. Sajiva Harapaddeniya and Dr. Namal Javardhana. First, I would like to welcome Dr. Sajiva Harapaddeniya, Senior Lecturer, Study Unit of Dravyaguna Vijnana, Institute of Indigenous Medicine, University of Colombo, Sri Lanka, to discuss about scopes of Rasashastra in Sri Lanka, challenges and opportunities. Dear Madam, this is your opportunity to share a bit of your immense knowledge with us.
Can you give the host action to me? Because then I can share my screen. Okay, can you see my screen? Hello?
Yes, madam.
Okay. Good evening for all of you. It is very big thankful to arrange this type of workshop or the seminar to getting knowledge regarding the Rasashastra. Today, I like to discuss the scope, challenges, and opportunities of Rasashastra. I think all of you know Rasashastra is the one of most important subject in BMS curriculum. When we consider the Sri Lankan situation, most of our BMS students they are very interested to learn Rasashastra, and also they're having very keen knowledge about the things what are the related with these and the opportunities they have. These things they are very keenly concerned. So that's why this topic is a timely needed one. We will discuss, and then after we'll see what are our scope and the challenges and what are the opportunities in Rasashastra. Okay. Rasashastra is when we see the traditional medicinal history, India and Sri Lanka have well recorded and a good practice, because in most of our two countries are very known, or the very well practiced this traditional medicine. And when we see the Ayurveda medicine and Siddha medicine and Unani, all these strains are practiced in Sri Lanka, India, and even Nepal, Bangladesh, these countries. And especially these systems always speak about this herbal preparation, and not only this herbal preparation, mostly in these systems speaking about the mineral and herbo-mineral preparations. Then we'll see what is this Rasashastra. I think no need to explain these things. All of you know about these things. But if any one having very basic knowledge or the not sufficient knowledge about this Rasashastra, we will very briefly see what is this. The Rasa is the science of mercury, because Rasa is the synonym for mercury, and also there is Rasashastra is a science of mercury, because it is the one of main important branch in Ayurveda pharmaceuticals. And mainly this Rasashastra deals with the mercury, and other than mercury, in Rasashastra we discuss about more minerals, metals, gems. I think you all knew calcium substance materials, and some toxic plants. All of these things we discussed on Rasashastra, and the indications and some what are the toxic effects and all these things we discuss under Rasashastra. Then Rasa, previously also I told, is a synonym for mercury, because always it is in a liquid state. We all know it is only a metal in liquid state in room temperature. And also when we see there are so many mythological stories regarding most of our Rasashastra materials, but in when we consider about the mercury, it is emphasized that it is a mythological, it's described as Simon of Lord Shiva, because to give the importance or the emphasize the importance of mercury, the origin is related with the Lord of Shiva, because he is the noble, the most superior person in Hindu religion. And we know we can't use all these materials, including mercury and other minerals, and any material mentioned and Rasashastra, we can't use as it is, because we have to follow some appropriate processing techniques, and all these processing techniques mentioned in Rasashastra text, because how we can what are the acceptable features, and how we proceed with processing, and how much time or how many hours we have to do this processing. All these description mentioned in our classical text. And also these rasa preparations effectively used in the treatment for most chronic, very dreadful diseases, according to Ayurveda, for the asadhya roga, and also for non-communicable diseases. And other than this, rasa preparation mostly used for getting rejuvenative and aphrodisiac effects. So these aphrodisiac or rejuvenative therapeutics, we use most rasa preparations. This rasa preparation described as rasa kalpas, and also the physician who is practicing Rasashastra considered as Rasa Vaidya. I think it's a special type of this when we specify this Vaidya as Rasa Vaidyas. He is not a simple physician. And we consider about the rasa kalpas or the rasa preparations. Mainly we can divide, or we have 4 types of rasa preparation. These rasa preparations are Karaliya preparation, the preparation which prepared by using mortar and pestle, and then the pottery preparation, especially the special type of preparation. Mainly we use in these preparations for very I think for the patients suffering from very dreadful diseases, or the last stage of diseases, use this pottery. And the Kupi Pakva Rasayana. Kupi Pakva Rasayana, mostly this preparation prepared inside the bottle. And the Parpati Rasayana is a very thin flat sheets like preparations. All these rasa preparation we can put under this any of this rasa kalpa. Any rasa preparations we can't describe we can't discuss beyond this Rasakalpa. That means we can put each and every rasa preparation under this any Rasakalpa. And when we compare these rasa preparations with herbal preparation, I think in Ayurveda medicine, in Unani medicine, most of these preparations prepared by herbal preparation. Then most of doctors or physicians, they interest about this herbal preparation. But when we consider this herbal preparation with this rasa kalpa or the rasa preparation, according to Rasashastra mention, these rasa kalpas are more superior than the herbal preparation. I think in Rasendra Sarasagraha nicely describe this superiority of rasa kalpas by using this rasa prasansa shloka. I think we know alpa matropayogitvat daruchera prasangata shipramarogya daitva daushadebhyo diporasa. That means all these rasa preparation, when we compare about the herbal preparation, we can use this rasa preparation in very low dose. And also it's having, we know most of these herbal preparations, our people doesn't like to get because they are having not a pleasant taste. But these rasa preparations having pleasant taste. And other thing, these our rasa preparations giving most quick and long, quick action, and also its preparation having very long shelf life. And that means after we administer this rasa preparation and all these other mineral or metallic preparation, by subjecting a proper processing technique, we can administer these preparations very effectively and also in safety manner. Very briefly, we will discuss about what are these processing techniques, because if we not follow these processing techniques properly, we can't get a very safety or the efficacious drug. So that's why very briefly we will see what are these processing techniques. There are specially mentioned processing techniques are Shodhana, Marana, Sattva-patana, Amritikarana and Lohitikarana. These are some important processing techniques for most of rasa preparations. And also we will see what is this Shodhana. We know the initial processing techniques or the step for each and every material is Shodhana. In Rasashastra, we can't use any this subjected material to the processings without Shodhana process. And if we see the word Shodhana, we will see it is a very simple process. Other thing we can see, or anyone can think, Shodhana, it's only a cleaning process. But the Shodhana is not a simple cleaning process. It's having very broad meaning. There are Shodhana methods. We apply different Shodhana methods for different materials. These Shodhana methods are Dolapapa, Dalana, Avapa, Nirvapa, Prakshalana or the washing, and Galana or the filtering, Mardana or the grinding. This type of different Shodhana methods applied in Rasashastra according to different Rasashastra texts. Nicely explain how we can proceed these Shodhana processes. By applying any of these Shodhana processes, the material convert into a special form it's a herbo-mineral compound. Because for the Shodhana process, most of time we use different herbal materials. So due to repeated contact with this herbal material, the initial material will convert into a herbo-mineral compound. And also several processing time, we use different materials facing for a different how different that mean example when we give the dola pak for it explain it will do for 24 hours. Example for haritana like material, we have to do the shodhana process for the dola pak by using these Kushmanda for 24 hours. That means due to long contact, the long contamination with this herbal material and the long time due to this heat, the increase of the brittleness of material can happen. And also due to this shodhana process, remove the toxic nature of the material. And also by this shodhana process can enhance the therapeutic effect of material. Example, if we take the hingula, we use bhavana, 7 times bhavana with ginger juice. It is the shodhana method for hingula mentioned in Rasashastra. By continuously grinding or the bhavana with this material, the therapeutic effect of the material will increase, because the hingula is a jaragna material. We use ginger juice. Ginger juice is also having jaragna effect. By continuously doing this 7 times bhavana, enhance the therapeutic effect of the hingula. Not only for limited for hingula, I took the example only for hingula. Likewise, we can enhance the therapeutic effect of the material. And also, by doing the shodhana process, some guru or the heavy materials convert into a very light or the lagu material. And other thing, always after completion of the shodhana process, most material convert into a very fine form. This fine form facilitate the next step for the marana process. So then after shodhana process, we have to convert this, we have to process this material into bhashma form. Most of material in Rasashastra used as bhashmas, but some materials after shodhana process directly can use for the therapeutic purpose. But some material convert it into a bhashma form. After bhashma form, we can use this material for therapeutic, to get the therapeutic effect. Okay, so these bhashmas are very fine, like preparation, and the very fine, we can get a fine form in finally. And even after converting these materials into a very fine bhashma form, as Rasavaidyas, we can't directly prescribe to our patients without doing bhashma pariksha. After completion of bhashma pariksha, so we can use these materials for patients. And when we compare these bhashmas in according to modern science, we can compare these bhashmas as nanoparticles. That means it's having a very Hello, can you hear me clearly?
Yes, ma'am. Yes, ma'am.
Yes. Then we will discuss about the scope of Rasashastra. Rasashastra originated and developed in India during the period of 2000 BC to 2nd AD. So the history of Rasashastra, I think we all us know, the Nagarjuna stands out as an important person, especially in 8th century. We can consider the golden era of Rasashastra is the Nagarjuna period. Especially the books written in this period gives the knowledge about both Loha Veda and Deha Veda. I think these are the main aims of Rasashastra, and most texts written in this era describes about this Loha Veda and Deha Veda very wide. Eighth century Hello. I'm doing my presentation without using the video because sometimes some disturbance happen. Therefore, without video, I'll do my presentation. Then the 8th century onwards, the paths developed rapidly, and most newer drugs form invented in this time, and more metals and minerals incorporated with Rasashastra. I think we know that there are 18 processes mentioned for mercury processing, and these processing techniques well documented in books written in 9th century to 14th century. And in this time, the Rasashastra embedded in the main medical stream. In that period, the main medical stream is Ayurveda. So that's why the Rasa medicine embedded in that period with Ayurveda medicine and emerged as strong popular medicine in India. With the advent of British colonial rule from 19th century onward, modern medicine spread very rapidly. Especially in this time, physics, chemistry, and other sciences developed in this period. And also, in this period, allopathic medicine became very popular due to its fast action. Because these preparations are easier way I be Kathmandu visual
Zoom ke වැඩ කරන්නේ දැන් ඉවර වෙයි එහෙනම් මේකේ තරග
වැඩ කරන්නේ නැහැ පුතේ. Zoom එකම රෙස්පොන්ඩ් කරන්නේ මම නයි ඉන්නවා නිකන් ඉනවා. ඉතින් යන්න Zoom එක රෙස්පොන්ඩ් කරන්නේ.
මේකයි තුනක් හොදට කළේ
ඉන්දියාවෙන් දන්නේ හොස්ට් කරන්නේ.
මේක තමයිනේ
එයාට ඉතින් මීටින් වල ඔක්කොම ටික වැඩක් කරනකොට එයාට මීටින් වල ඔක්කොම. ඊට පස්සේ වැඩ කරන්න හොඳ නැහැ ගෙදර ඉඳන් මොකක් හරි එකට තියෙන යන්න කොහෙට හරි. මේ Zoom එකම රෙස්පොන්ඩ් කරන්නේ නැහැ නේ පුතා මෙහෙට. නෑ මම මොකුත් කියන්නේ නැහැ. ආ. පුත් කරන්න බැරි වෙයිනේ. නෝ ඔෆ් කරලා කියන්නේ වහිනවලු. මොන එකක් කියනවා.
හරි කොහොම ඉන්නේ යා try කරයි බලන්න.
දැන් ප්‍රසන්ටේෂන් එක ගන්න. ලීව් වෙනවා මම එනවා. ලීව් වෙන්න බෑ. ලීව් වෙන්න බෑ ලීව් වෙන්න. මේක ලීව්
We will try to connect Madam later. And now I would like to welcome Dr. Namal Javadana, Senior Lecturer, Study Unit of Kaya Chikitsa, Institute of Indigenous Medicine, University of Colombo, Sri Lanka, to discuss about Ayurveda and Sri Lankan traditional medicine management of orthopaedic conditions. Dear sir, this is your opportunity to share your immense knowledge with us.
Good evening to all of you. And there's another problem in my lens also. Anyway, I will do my presentation. Very good evening, and today is the third day of the webinar series, and Rishiram Koirala Memorial Webinar Series. And first of all, I would like to give my heartful thanks to the organizers and from Nepal, India, Bangladesh, as well as our Sri Lanka, and some student unions. They have organized this seminar. The Sri Lankan student union also from IIM. They also joined with the other international collaboration, and they organized a very effective seminar series. And first of all, my thanks goes to everyone. And this is the third day. And actually, I am from the Institute of Indigenous Medicine in the University of Kathmandu. And my topic is actually the Ayurveda and the Sri Lankan traditional medicine management of orthopedic conditions. And these orthopedic conditions, normally these orthopedic conditions are explained in the Ayurvedic classical text as well as our Sri Lankan traditional system. Because of that, I thought that I have to initiate this session by comparing these, what is the Ayurveda thing and what is the traditional medicine in Sri Lankan system. And everybody knows about the Ayurveda in Nepal, Bangladesh, and everybody knows. And I want to have show the link between the Sri Lankan traditional practice and the Ayurveda. The Sri Lankan traditional medicine is a combination of indigenous medicine of our country. That means our Deshiya Chikitsa, our term is Deshiya Chikitsa, and the Ayurveda received from India. That means in our system, we are having two parallel systems linked together. The Ayurveda from the India and our traditional system, our Deshiya Chikitsa part from the our own medicinal system. And Ayurveda that emerged in Sri Lanka from the middle decades of the 20th century is complex mixture with the island indigenous medical practice. That means our system, our traditional system, our Deshiya Chikitsa mixed with the Indian system, that it emerged the middle decades of the 20th century. Before that too also, our system had some link in between the Indian Ayurveda system. But Ayurveda is the official term. In our 161 number 31 Act, it says the Ayurveda is the common term for our Sri Lankan system of this traditional practice. It contributes the other systems also, other disciplines also, such as the Unani, Siddha, and the traditional medicine, yoga, and everything are linked to form the Sri Lankan Ayurveda system. The Ayurveda is infused with the theories and the principles. In Ayurveda, system is a philosophical system, and it has a lot of theories and the principles. Everybody knows those things. But in our indigenous system, our knowledge system is gained throughout the experience rather than derived from the philosophical concept. Our system, our indigenous system, it doesn't have a lot of philosophical concepts. It has only the experiences. What are the experiences we are having? We are having the practicable experiences. That means that our earlier generations practitioners, they practiced very well. They know what is the condition, what is the disease condition, and according to the disease condition, they have their own medicinal treatment process, systems, and this is handed down from the generation to generation. That system is inherited within their family tradition. That is our own system. And the early medical history of Sri Lanka is about the legends, according to which is the King Ravana, the prehistoric ruler in our island. The most of the people know that the things about the King Ravana, and especially the Indian people and the Nepal and Sri Lankan people, we know about the Ravan. And the Ravan is a great thing, as well as he is a versatile medical practitioner. That he had a lot of medicinal practices, and also he is the Ravana. The King Ravana is believed to be a author of the medical manuscripts. These are some examples: Araka Prakasha, Naga Vinyana, and Kumara Tantra and Uddisha Tantra. These are some of the King Ravana's the manuscripts. And actually, the King Ravana's grandfather, in Sri Lankan students, they know very well, and our physicians know, the King Ravana's father is the great Pulasti Rishi, and he had some link with the Indian system. And the ancient history says that he visited to the Indian conference, and he participated that conference which held in the Himalaya area. And this is how our Sri Lankan traditional system mixed with the Indian Ayurveda system. And after that prehistoric period, the ancient kings, and they also practiced. They also known as the great physicians. And from 6 BC to the 1850, and these period also we had a great primary healthcare system in our Sri Lanka. In this period, we had only that our traditional system. We did, in that period, we didn't have any allopathic system or any other traditional, any other practices, but we had our own system, and we established this healthcare system very well. And in that period, there was some authentic text also in our system. The Sarartha Sangraha is the main authentic text we found, written by the great king, and also by Sajja Mandisha, Vatika Prakarana, Deshiya Chikitsa Sangraha, and the various oral leaves and the handwritten manuscripts are available as written materials. Most of the books or the manuscripts, they contain a lot of medicines, the variety of medicines, and they consist mainly of many valuable medicines and the treatment methods and the belief techniques which we are using in the present also. And the existence of the first hospital, that means in that our the era of our great kings, and the very first hospital is sited in the Mihintale area. Even the ruins are available nowadays also. This is the structure of that hospital. And these things highlighted how Sri Lankan practice were in the early eras also. And this hospital, especially this hospital being perhaps the oldest hospital in the world, and some literature says about these history of these hospitals. Not only the Mihintale hospital, there are some other the hospitals also in the Polonnaruwa era, and the other the Kandy and the older periods shows these type of very architectured hospitals. And the Sri Lankan system of traditional medicine is rooted in the holistic healthcare system and focused on the treating the body as whole. It's the same as the Ayurveda system. We also focused to the as focused as holistic healthcare system, and also we also focus to treat the body as well as the mind also. And there are actually several areas that encompass the traditional medicine. There are several traditional fields, traditional generations there, especially the fracture healing. We call it as Kathmandu Vedakama, and the snake bite, Sarvavisha, and the Asvedakama, and eye treatment, and the psychiatric, Unmada Vedakama, burns, the Umpilisum Vedakama, and the treatment of abscess wound and the cancer, Gedivana Pilika Vedakama. Likewise, there are so many traditions, so many different traditions there in practicing Sri Lankan traditional medicine system. And today's my topic is actually focused on the fracture healing or the Kathmandu Vedakama, and I try to combine the Ayurveda system as well as the traditional system. And finally, I would like to show some the practical things and one case also have a better understand about our practicing nowadays in Sri Lanka. And the Bhagna in traditional medicine, and the Sri Lankan traditional system for the Bhagna also well developed, and we handle the very complicated fractures with the better outcome, and also the topical herbal application over fracture site, including Pathu, Malum, and oil, we are using as the medications and the medicines. In addition to oral herbal formula, also we are using as to cure this type of disorders. And the thing is, in Sri Lankan traditional system, we are having lot of prescriptions, lot of medicines for the fracture healing. Especially, we are using external application, especially the external applications. And the very commonly, everybody knows the common etiological factors of these fracture, and the Pathana, the Pidana, Prakarana, Akshepana, as well as the Vyalamrugadashana and the Abhigata. These are the common causative factors which mentioned in the Sushruta Samhita, Nidanasthana, and these causative factors are very well common to the nowadays also. When we see in our Sri Lankan cases, most of the cases due to the road traffic accidents as well as some fallen down or any traumatic condition, there are so many cases we can found. And these are the common positive factors. And the common clinical conditions also, there are a lot of clinical conditions in Bhagna Chikitsa, and normally we are dealing with the fractures for the Bhagna, and also sometimes we are dealing with the dislocation also. But there are some other conditions also, strains, and the contusion, open wounds, and there are so many other conditions. And here I have mentioned very few conditions, but there are a lot of other conditions also we have to think about when we are doing the Bhagna Chikitsa. And one by one, the sprains, and the sprain mean the stretch or tear or both the ligament, and that means most there are some special areas, most vulnerable body areas to sprains, like ankle joint, a knee joint, and the wrist joint. And these strains are due to due to some accidental movements, and it damaged the tendons as well as the body muscles, and it is not affected to the bone conditions, as well as it is not the dislocation type of damage. And it is graded by the modern medical practitioners in the grade 3 sprain. It's a severe condition, and it is somewhat of the complete tear of the ligaments, and it may cause significant instability condition. And the various type of pain, bruising, and swelling, and the inflammations are common to all the categories of the sprain. And normally, the patient can't patient is unable to move, and there is maybe the mild to severe type pain is there, and the patient is having the mild to moderate or the severe type swelling also, and it definitely it needs some therapeutic. We have to do some therapeutics for the relief of that strain condition. And I will explain later on what are the treatment things we can apply for this strain condition. And the strain is the second one. The strain is an injury to the muscle or the tendon. And the similar to strain, a strain may be the simple stretch. It is a simple stretch to the muscle or the tendon, or it may involve a partial or the complete tear of the muscle and the tendon. And the strain and the strain both are somewhat similar, and the causative factors are a little bit different, and the muscular damage and the tendon damage somewhat similar. And here also it contains the pain and the muscle spasms and the muscle weakness, swelling, inflammation, and cramping also. And this one also somewhat complicated if the causative factors are the very severe type causative factors, the strain and the strain are getting more worse. And the contusion or the bruise or the closed wound, actually this is happened direct by the blow. That means by the blunt object and the strike part of the body. And due to this traumatic condition, the tissues are tissues covered by the skin get damaged. It's a closed wound type damage, but inside the skin there is a damage of the muscles and the tendons, and without breaking the skin. And the discoloration of the skin is present, and the bluish discoloration, blackish, and also the purple color discoloration, and those are some skin discolorations appear in this contusion condition. And also there may be some swelling conditions also, and the pain also present in that contusion condition. And this is a very simple condition, but sometimes it is the traumatic condition is very hard. Sometimes it may get very worse condition, and if we neglect these three conditions, the hardness of the muscular tissues is getting, and it is very difficult to cure, and we have to attend by having the variety of paste and the variety of oils we have to use if we neglect these conditions. And for these three conditions, we have to follow these things and reassure the patient. The most of the patients, they may think that their bones get damaged, or there may be some fractures condition, or there may be some dislocations, because some strain and the blunt the wound condition also, the severe swelling is there. Because of that, patient may think there's the very big traumatic conditions such as that the fracture or the dislocation is there. Then we have to reassure the patient, and we have to support the site also. Before doing any treatment, we have to support the site. That means we have to protect from any other the strainful conditions. The third one is we have to apply the medicine. For that, we are using a lot of medicines, and we are using a lot of medicines. We are having our herbal remedies, herbal medicines, and on our indigenous prescriptions we are having. And I will show some prescriptions and some medicines in later on. And we have to check the circulation also. That not only the blood circulation, we have to check the motor functions as well as the sensory functions also before and after splitting. We have to apply the splitting also. Then before that, we have to check that blood circulation and the motor function and the sensory function. And sometimes our splitting is having too tight. Because of that, the blood circulation is getting blocked. That condition also may cause some abnormal condition to our damage area. Because of that, we have to be careful about our treatment, and also that we have to be careful about our dressing also. And we have to apply the splint and immobilize the injured limb part or the body part. And elevate the injured limb is necessary because there may be some the swelling condition is there, and we have to support the minimize the swelling, and because of that we have to elevate the limb condition. Those are the some general measures we have to follow. These three simple conditions, strain and the other contusion conditions also. And there's another condition, everybody know that if there is any traumatic condition, there may be an open wound. And these open wounds are in these type of open wounds, abrasions, laceration, incisions, and the punctures. And most of the wounds, they are having the bleeding, and also the maybe painful condition, maybe severe pain, and then we have to do some therapeutic intervention. And the last picture shows the punctures, and by the sharp the stab wound type, and by the sharp instrument. And for this management, we have to wash or irrigate the injury with the warm medicinal decoction. Actually, we are using normally we are using the Panchavalka decoction, and in here in Sri Lanka, we are using the Dar Haritra or the Haritra or Nimb bark as the medicinal decoction, and there are so many other the decoctions also, and very commonly we are using these Dar Haritra, and Panchavalka bark for the as for the medicinal decoction to wash out the injured area, and remove all the foreign bodies. That also very essential. And if we are not removing the foreign bodies, that it can be a secondary infect, and it may be another conversion of our this open wound condition. And the control bleeding by applying the local compression and dressing, it is also very necessary. And the bleeding is one of the most we have to attend this bleeding. Otherwise, the patient may, if it is a severe bleeding, if it is a profuse bleeding, the patient may have a lot of complications. Because of that, we have to arrest the bleeding by using our own medications. And if it is the very severe type of injury, then we have to do the suturing, and after that also, if there is any bleeding conditions occur, we have to apply our own medicines. And there are especially we are using some medicinal oil for the arrest bleeding. In our traditional system, we are having in traditional system that we are having a special type of oil. I can show you here. This is the one, and I think everybody can see. And this is the yellow, the green color oil, and this is a traditional oil that we call it as the Nilyadi oil, which has several the leaves, the green leaves, and mixture with the coconut oil, and the normal oil preparation we are doing for this oil, this oil also. It has a very good effect to the stop the bleeding conditions as well as the wound healing action. And normally all of our Sri Lankan physicians, Ayurveda or the traditional physicians, we are using this Nilyadi oil for the several conditions. And we have to apply the bandage and may be applied by the tactile situations. Will useful the pre-cloud application field dressings that are needed for the more serious injuries. If the injury is a very serious one, then we have to attend this, we have to do some special therapeutic techniques. We have to arrest bleeding first, as well as we have to do some suturing techniques also. And the secondary treatment measures should be focused on prevention or stopping the infections. Actually, for that, we are using some internal medications, internal medicines, especially the Ayurveda medicines, as well as our traditional medicines we are using. We are using actually the ingredient name is the chopachini, containing some medicines. It also acts as some anti-inflammatory medicine, as well as it gives some protection to the wound, as well as it increase the healing action also. And if the major tendons or the muscle, that means the very severe damage, very severe injury, complicated injury, and we have to do the further treatment, and we have to get some support from the other medicinal systems also, because if the major tendons or the muscles damage or the major blood vessels damage, we have to do it is somewhat of a surgical type intervention need. Then we have to take the other consultations also. And these are some, earlier I have mentioned some small conditions, and that they are in our orthopedic conditions. And the fracture for the Bhagna is another set of condition. And Acharya Susruta has classified the fractures and the dislocations as two types, Kanda Bhagna and Sandhi Bhagna. I think that everybody knows about these things, Kanda Bhagna and the Sandhi Bhagna. And the Kanda Bhagna, there are 12 types of Kanda Bhagna, and the Sandhi Bhagna or Sandhi Mukta, there are 6 types. And in a single heading, it can say that those are Bhagna. And the Kanda Bhagna turns a break in the continuity of bone, which may result in the partial or the complete destruction of the bone. And the features are further classified into open, and the fractures are classified into open for the closed fractures. And the several fractures are open wound fractures, and it also having 2 types, and the inside out and the outside in. That means inside out means the bony, broken bony parts, the end parts are coming or the pierce in the skin. That is the open type, one type. And also outside in with the external foreign bodies are coming to the layers, inside layers of the maybe the bone or the tissue materials. And there are 2 types, and these 2 types we have to attend in different times. And the outer means the fracture without any active open wounds, or the simple closed fractures are there. Okay. And first of all, we can discuss the dislocation. Then after that, we can go to the fractures again. And the dislocation is the displacement of the bony ends and the joints, articulated surfaces of the joints, resulting in abnormal stretching of the ligaments around the joint. That means there is a displacement of the body end. The joint is having the two or more bones, and one of them can displace in the dislocation, and sometimes cause tearing of the complete ligament separations also. When the dislocation of the bone is occur, there may be damage to the surrounding tissues also. The ligaments and the tissues and the muscles can get damaged. The partial dislocation is referred as subluxation. The dislocations may be partial, or dislocation may be complete dislocation can be occur. And in that dislocation, not only the bony dislocation, there may be other surrounding tissues also getting affected, especially the muscle, tendons, and the blood vessels, and the nerves, and all the surrounding structure, or the tissues, or the structures which combine to form the joint is getting damaged. And these are the 6 subtypes of the dislocation, and everybody knows about these things, these theoretical parts: Uttishta, Vishlishta, Vivartika, Adakshipta, Atishipta, and Tirakshipta are the 6 subtypes. And Adakshipta, Atishipta, and Tirakshipta are the complete dislocation. The other 3 are some partial dislocation, maybe the subluxation types. And anyhow, we have to attend to this dislocation, because normally patient can't do any therapeutic intervention for the dislocation by its own, and because of that, it needs some help from the doctor. And the other supportive staff also, they also can't attend this type of things, especially nurses. They can't do those the therapeutic intervention. Because of that, we have to attend, and we have to do the relocation of this and displaced bone. And symptoms are the most prominent symptom is the limited or lost motion, that the patient can't move. Patients are unable to move his affected area or the affected limb. And pain during movement. During the movement, the pain is always there, and maybe the severe pain, or maybe the mild or the moderate pain is there. Anyhow, the patient, if the patient can't bear the pain, then there are some other complications also occur. And sometimes initially the pain is very less, and then after the pain is increasing gradually, and the pain is one of the prominent signs in the dislocation. Numbness around the area. The initial numbness is there, and then after the numbness is coming down little by little. And because of the numbness, the patient may not have the painful condition, but after relieving this numbness condition, the pain is getting more worsened. And the numbness also due to some effect of the nerve tissues, maybe directly or maybe indirectly, it can get damage, or it may get confusion. Then the numbness condition can occur, and also the paresthesia and tingling feeling. There are some other sensations also this affected time. And the management of dislocation is the treatment will depend on the site and the severity of the injury. And if the joint does not return to the normal naturally, then we have to do the manipulation or the repositioning. That means sometimes that the minor conditions, minor subluxations can reposition by own, and the patients are doing some tightening things, and because of that tightening, or the patient is rotating his arm or his hand or the affected side, then it is normally can relocate their normal side. But if it is unable to relocate, then we have to do manually. Then the manipulation or reposition we have to do. If not, if we are not knowing those techniques, if the technique is somewhat different, and we need much more time to do this all the techniques. So each and every cases there is a technique to the manipulation, and it needs much more time to explain these techniques. Anyhow, if the physicians is unable to understand the disease condition, unable to understand this the dislocation type, or if he attend in a wrong manner, then it may lead to have another type of disorder, another type of Wagner type. And that means the patient's condition get more worse. If he didn't do any repositioning, and if he apply to the patient that tissue strengthening paste or the medicines, if the bones are in wrong position, then it leads to the fixation of the joints with the wrong position of the bones. That may be another condition. And because of that, each and every physicians who are practicing the orthopedic things, and we have to be very careful about this manipulation or the repositioning. And we have to do the correct technique, or otherwise there is a simple dislocation is there. But if we are engaging in the wrong way, then the tissue damage may get more. Then it may be the worsening the condition by ourselves, right? And after manipulation, then we have to apply the medicines, and there are a lot of medicines applied here, and I will show some special phase what we are applying in here, and these preparations are that the traditional preparations, and normally our Sri Lankan traditional practitioners as well as our Ayurveda practitioners, we are using these type of medicines, and there's some traditional practitioners, they have their own the medicines, and but these medicines are very common because in our institute we are explaining these prescriptions, and we are practicing our Ayurveda teaching hospital also, and because of that, these paste and these oils are very common to our doctors. And immobilization, that one also very important, because when we are considering the adakshita type of dislocation, then we have to reposition the humerus bone, and the initial step we have to immobilize, and we have to use the sling or the splint or for the several weeks to prevent a reoccurrence. Otherwise, some conditions are habitual dislocation type of conditions. These dislocations can occur several times and repeatedly, and because of that, we have to prevent till that surrounding structure is getting strength. Right? The internal medications also we can give the pain relievers or the muscle relaxant medicines we have to give. Normally, we are using some decoctions for this, and especially the Vata Shamana type of decoctions we are using, and the Dashamula decoction normally we are using, and the Dashamula decoctions with the Abhya, Rasona, and the Methi added, and we are having some decoctions, and also the air under Saptaka decoction we are using. Actually, these decoctions are doing some pacification of water, and because of that, the pain is getting gradually lower. And the rehabilitation to increase the joint strength and the restore its range of motion. After fixation of these muscles and tendons, and sometimes this entire joint part is getting more stiff, Because of that, we have to do the rehabilitation part. After doing our treatment, the patient is unable to raise his hand. That is somewhat the adverse effect from our medicine. Actually, it is not an adverse effect that we have to do another part to normalize the joint. Then we have to do the rehabilitation part. It is one of the necessary thing after and while doing our treatment, we have to do this rehabilitation part. And also there is some damages. It needs some surgical intervention. And if there are damaged nerves or the blood vessels, then we have to do the surgeries. Then is somewhat beyond our control level, our traditional level control. It is somewhat secondary, tertiary level practices. Then we have to transfer the patient, and with the supportive, we have to use some supportive techniques to immobilize the joint area, and we have to transfer the patient. Those things we have to have a good idea about these things, because we have to know about what extent we have to cover, or otherwise we have to transfer the patient. And the Kandabagna, or the fracture, is another the important part of this Bhagna Chikitsa. And everybody knows about there are 12 types of fractures, and I'm not going to do the detail of these subtypes: Karkata Bhagna and Ashtakarnite, Churnite, Pichite, and Astajallite, and Villitaka, and Manchanugata, Atipata, Vakta, Chinna, and Patita, and Sputita. These are the several, the 12 types of the Kandabagna, and we have to have an idea about these subtypes also prior to the giving the treatment, because sometimes the treatment may be the same. We can apply the local application; those are same for all the fractures. But the thing is, we have to do the manipulation things. We have to do the tractions. We have to do some reductions prior to the medicinal treatment. For that, we have to have an idea about the types of fractures. And the clinical and diagnostic features. And Shavatu Bahulyam, that means the localized swelling is there. Each and every fracture, there are swelling, and the swelling may be due to some internal hemorrhage, or maybe the tissue damage. The swelling is somewhat swelling is sometimes it is it may give some confusion about these fractures, because we can't identify the real type of fracture because of this localized swelling, and also the spandana vivartana, and sometimes the sparsha asanishata, and the local tenderness over the site. And this tenderness is somewhat very difficult to handle the patient. If there is any tenderness condition, the patient may have the severe pain, and the patient may not allow to, he is not given any chance to relocate the fractured area, and it is somewhat bad, the adverse effect. And Avapedyamana Shabda, and the crepitus and the grating while injured party is moved. And there may be some crepitations, crepitus sounds. And because of especially the Surnita, Sputita like conditions, there may be some crepitus sounds. And Shratangata, that means the visible deformities there. If the fracture is in the wrist joint, there may be the visible deformity. And any other locations also, even in the finger, even in the very small area, if there is a fracture, especially in the complete fracture, there may be visible deformities. And the vivid Vedana Pradurbhava, pain of various types, maybe the frequent type of pain or sometimes through the Veda, likewise the pain is in the varieties. And the Sarvayu Avastasu Nashrama Labhav, that means these features, these clinical diagnoses are mentioned in Susruta Nidana. And the last one is to make impairment of functions. The patient is unable to do his normal routine things. Even patient patient is unable to move his affected site very small rotation or small function also getting hampered. And the examination part is very important. The thorough history is the first step. That in history part, the mechanism of the trauma or the positive factors of this, we have to have an idea. If there is any traumatic condition of the fallen down, we have to have an idea about what type of thing was happened. And the second one is past medical history of the assess any morbidities. Sometimes the patient may have some tuberculosis conditions or any cancerous conditions, and the cancer is affected to the bone, and the bone there may be some bone cancer also, and it affected to the site and pathological fracture can occur very easily. Then we have to have an idea about the past medical history also. And the history of the medication. And sometimes patient may take some other medicines, and which can lead to the bony deformities. And especially the long-term use of the prednisolone may affect the bone and joints. And then we have to have an idea about the past medicines and the previous injuries also. If the dislocation is occur, there may be some previous dislocations. That means the habitual type of dislocation can occur if it is not treated very well. And next, do the physical examination part, and the inspection is very well, and we have to do the darshana pariksha, and dislocation or the swelling or the deformity, we have to have an idea, we have to understand, especially when we are considering the adakshipta type of dislocation or the theodakshipto atikshipta type dislocation. By seeing it, by inspection, by darshana pariksha, we can have an idea about the type of dislocation, and it will help to the reposition of the joint. And inspection is very, very important. And even the fractures also, we have to first of all we have to do the inspection part, and the appearance of the deformed site, we can have an idea about the disease condition. Another example, I can say that the patient is coming, and when we are examining the patients, it's affected limb is having lateral rotation, as well as the very shortening of the leg is presented. Then we, by seeing it, by inspection, we can see, we can have an idea about the fracture type. Most probably the fracture is maybe the femur neck fracture, right? Then because of that, the inspection is very much important. And the palpitation, and the looking for the tenderness and the deformity. By palpitation, we can have an idea about the condition. And for an example, if it is the adakshipta type, downward displacement of the shoulder joint, we can palpate, and we can have the clear-cut idea about the adakshipta type. And also the atikshipta also same, we can have an idea about by doing the palpation. And assess the range of movement, and we can ask patient to move his affected side, and we can have an idea about by assessing the range of the movement, and both active and the passive movement, we can have an idea. And the neurovascular examination also we have to do. And the management of the fracture, first of all, we have to think about the airways or the breathing or the circulation disabilities and the patient environment, and those are the common things. And the controlled hemorrhage is very, very essential. And the pain relief techniques we have to use. We have to use some internal and external medicines to relieve the pain, same as the previous condition, and treat any associated injuries and cover the injured area with the dressing. And for the fractures and the dislocation, we have to give the treatment, and I will show some special case in our traditional practice. And check distal pulse before and after splitting, and same as the previous the dislocation condition, and immobilize the fracture using splints, and check pulse and the motor and the sensation. And Acharya Sushruta also mentioned some techniques, and the reduction and the Pidana and Sanshepana, and the retention, Bandhana, Tailadoni, and the fraction is somewhat different. And the rehabilitation and the Mut Lavana and the Pashana Dharana is the type of Acharya Sushruta mentioned, and also some simple Vyayam also we have to do as rehabilitation technique. And splitting and splints and the splitting, and we are using some wood item, the bamboo, neem, and mahavir, and asana. These are some special type of wounds we are using for the splints, and is very much useful for the fixation and the protection of the injured part of the body. Actually, the aim of these splints are immobilize the injured body part and prevent further damage to the muscle, nerves, and the blood vessels caused by broken ends of the bone, and prevent a closed fracture from the converting into the open fracture. These are some the aims of these splints, and I can show some splints we are using, and here these are the splints we can use, and these are some bamboo splints, and we have to be careful. These splints should be very smooth on both sides, and the edges also very should be smooth. And after that, these things, and we have to cover by using the cotton wool as well as the cotton bandage, and because otherwise if we are not covered in a proper manner, then it can also sometimes it can damage the skin areas, and because of that we have to be careful of this splint by using splint also. And the splitting that means that if we are we have to do the tight bandage, and by using this splint, and we have to be careful about the blood circulation, as well as the we have to be careful about the confusion of the other surrounding tissues due to our splints. And another aim is we have to decrease the and control the pain also. And the last condition I am saying in here is the malunion or the non-union of the fractures. This is one type of malunion condition, the fracture of the clavicular bone, and we have to to do the relocation of these fractured sites. Otherwise, if we are applying the our paste or whatever the bone healing things without doing this traction part, then it gets malunion. Normally the upper limb and the lower limb and another places also the fractures, if we are not relocated properly, there can be a malunion or the non-union conditions. And these are some special medicines we are using. The mellum. Mellum means some special type of preparation. Here I can give some examples, and this is one example actually. And here, this is one example, and you can see. And this is some medicinal ingredients, and we are lightly cooking these ingredients, and by using the pan or pot, and after cooking these ingredients by using some especially the tiller, and we can apply these things for the especially for the healing of the bone, as well as some contusion conditions and joint dislocation also. And medicinal roti or the behet roti, and the same as the above preparation, there is the roti type application are there, and we have to prepare these things by using these medicinal plants, and we can apply over the damaged area, especially the fracture healing side, and this is increasing, these medicines are increasing the healing action of the fractures, as well as the paste for pattu, and there are some special paste we are using for the fracture healing, and the paste is applied to the reduce muscle strain and heal contusions as well as the fractures also. And the behet pani mean or pani pattu we are calling, and these also we are using the honey, the bee honey, or any other trickles we are using, and these also highly important to increase or they stimulate the fracture healing action. And the telkira, and this is somewhat especially used in the end stage of the fractures, and it also stimulates the fracture healing process and provide nourishment to the supporting surrounding tissues. And I'm not explaining in detail about the prescriptions, and some special oils we are using. The Nilyadi is one of the special our traditional oil. Most of our traditional practitioners as well as our Ayurveda doctors, we are using this Nilyadi oil and as Yastimadi oil for especially the bone healing process, stimulated by the Yastima Madhu oil, and the Kukti Prasarni is somewhat a special type of oil we are using for the malunion conditions, and Paratel also somewhat the traditional oil we are using for the malunion conditions, and there are a lot of other oils also, some general oils also we can use for the nourishment of the surrounding tissues as well as the healing, stimulate the healing process. And the pharmacodynamic action of these medicines are very simply we can say the Shotahara and the prevent edema, especially all the conditions it may have some edematous conditions, and we have to the prevent edema condition. Otherwise, if the edema is the fix or the edema is getting hard, it is somewhat difficult to move the affected area, and that means it can restrict the joint movements. And the Vedana Sthapan, it is necessary. It is highly necessary because the patient is suffering, and we have to reduce or we have to do some analgesic action by our medicines, and all these medicines are having these actions, and Pradahanashaka, that inflammatory conditions we have to prevent, and all these medicines they are having these inflammatory conditions, anti-inflammatory action also. And Sandhaniya, that especially the bone healing action, especially sometimes of these pattu and the paste and the mellum, they are having this bone healing action, and it stimulates the fractures fracture end. When we are considering the allopathic system of medicine, what they are doing is they are doing that reduction and by using several techniques. And but the thing is, they are not using any type of medicines to improve to stimulate the healing process. But in our system, the Ayurveda as well as the traditional system, we are having lot of medicine to stimulate this fracture healing process. That is somewhat one of the advantage we are having. And Runa Shodhana, if there is any wound condition with the fracture or any other the orthopedic condition, then we have to heal the wound also. And for that we need some Ranashodhana process. It may be somewhat external Ranashodhana and there are some medicines for the internal Ranashodhana also. We don't need some allopathic, even we don't need the saline to Shodhana process, external Shodhana process. And we are having some Shodhana techniques and some paste or some local applications, local creams we are having to this Shodhana process, purification process. And the Daha Prashamana. Daha is another clinical condition in this orthopedic disorders, and we have to prevent that Daha Prashamana. The patients are complaining. The patient is having sometimes the burning sensation, sometimes the Vedana or the pains, and the numbness is there, and the Daha also one type of the sensation. Patients have the abnormal sensation, then we have to attend that one also. And the antimicrobial activity should be there because sometimes there may be some open wound or otherwise some the minor wounds we can't see in our naked eye. Then, however, what we are applying over the wound or the fracture area, it should be having the antimicrobial activity also. Otherwise, the wound, the minor wound or the major wound, it may get in the Dushtarana type conditions. And finally, we need the runner opener. And actually, in our systems, Ayurveda or the traditional system or any other system, we are having the enough prescriptions for the runner opener. And these are very highly effective. And as Acharya Susuta mentioned in the Pranadhikara, the last therapeutic intervention is that Saptamang Vaikrutapaham. Vaikrutapaham, the abnormal scars also removal by our own medicines. And the runner open and the Vaikrutapaham is the final the action of our medicines. And Uttejaka is the stimulating, that means we are giving actually stimulating things. What are the stimulating mean? We are giving stimulators for the fracture ends, especially the bone ends. And these stimulant, they stimulate the ends of the fractured bone, and they are they union the union of the fractures is getting very rapidly. This is our ultimate goal. For an example, that what I showed in the earlier, that the medicine, the dark brown color medicine, it is our traditional preparation, and normally if we can apply the any type of fractures, and within 2 weeks period, the fractures is getting healed. Then we have to be careful about the relocation of the fracture, and we have to relocate it very well, and then after that we can apply our paste, and within 2 weeks time it is getting the fix or the heal of the bone part. And the springs are very well necessary, and earlier also I explained we are using some wood item to have these splits. And this is the last thing I can show you. And this is the one baby, and in 2019, I think so, that he came to my place, and this is the age of 29th day. He came directly from the hospital, and he has a disease condition. He had this disease condition, and this is the disease condition. Actually, his all the limbs and the bones are getting fractured, and without having any traumatic condition. And uh, uh, they named the disease osteogenesis imperfecta, and this is the disease condition, and it is also known as the brittle bone disease. And disorder is present at the birth, and uh, the child born with this disease condition, and his bones are getting very soft, and it is breakable. And normally the fractures are occurring without having any traumatic condition. And they said that especially, and he was in the ICU, and after having a little bit recover, that they discharge, and they say that no need to do the further treatment, and he will die by fracture his bones, and likewise. And after that we applied some treatments, and all over the body, all over and we applied some oil and the paste also, and I think I applied this medicines more than 6 month period, and after that the X-rays also shown like that the bones are getting healed, and the fracture area are getting healed, but there may be some small deformed areas also, because we can't relocate the exact areas. And here, after a few months, after this X-ray also, he had some other fractures, and so finally now he is I think 3+ years old. Now he is having no any fractures or no any complications of the bone deformities. And here you can see in here this area there may be his left leg, there may be some deformed area, and the fracture healed with the deformities, and the other areas are normally normal functioning. And this is one example about our traditional practice and the practice of the fracture healing, even though that they are saying that this is some congenital deformities, and they can't do any treatment, therapeutic intervention for these type of fractures. But anyhow, in our traditional system and our Ayurveda system, we can interact, and we can do some positive treatment, therapeutic intervention for such type of even the hereditary or any other congenital type of disorders we can attend, and we have some successful treatments also. I think that's enough for the presentation, and thank you very much for listening me. Again, I would like to give my sincere gratitude to the organizers who organized this webinar series, and Rishiram Koirala Memorial Webinar Series, and thank you very much for Sri Lankan inviters also, especially our students from the Institute of Indigenous Medicine, as well as our Indian, as well as the Nepal and the Bangladesh doctors and the lecturers and everyone. And thank you very much again.
Thank you very much, sir, for sharing your valuable knowledge with us. And Dr. Herapaddeniya connected again. So I invite Madam to resume the rest of the lecture.
Hello, good evening. Sorry for the previous session. I started my lecture, but there's a disturbance happened. So anyhow, I will start from this slide. We already discussed the basic Rasashastra things, and here we will see what are the scope of Rasashastra. Already I told it is originated and developed in India during the period from 2000 BC to AC AD. The Nagarjuna, Bhikshu Nagarjuna is the important person, especially who done very valuable things and who gifted very valuable things to the Rasashastra in the 8th century. We can consider it as a golden era of Rasashastra. And there are so many books written in this period regarding Lohaveda and Dehaveda. Yes, then in words, Dehavada part developed rapidly because almost this Dehavada mainly related with some preparations which we can use for rejuvenative and aphrodisiac process. And in this period, there are many newer drugs forms were invented, and more metals and minerals other than mercury, more metals and minerals incorporated with Rasashastra in this 8th century. And also the mercury processing techniques, so that means Ashtadasa Sanskara related Lohaveda, also well documented books. These things are well documented in our Rasashastra books. In 9th century to 14th century, there are many books written regarding this 18th Sanskara. And also in this period, Rasa medicine embedded with the main medical stream Ayurveda. Already I told that period, the Ayurveda is the main medical stream, and in that medical stream emerged this Rasashastra, and it's worked as a strong popular medicine. Then with the advent of British rulers from 19th century, the modern medicine spreads in India and the Asian countries very rapidly, because in this time physics, chemistry, like other sciences also developed. In this period, allopathic medicine became more popular in generation, because this medicine having the fast action, easy availability, and this product prepared in very mass scale. Initially, I discussed this. Most of these rasa preparation, especially in Deha to achieve the Dehavada, prepared this for achieve Rasayan and Vajikan effect. But today, these rasa preparations we effectively using not only for getting Rasayan and Vajikan effect, we use this preparation for most chronic dreadful diseases like cancers and cardiac disorders, or sometimes for kidney disorders. Very efficaciously we use this as a preparation. And most of these as a preparation used as very fine ash-like or bhashmas preparation. These bhashmas, very basically we can consider this as a metal herbal compound formulations. All these rasa preparation are used as treating agents for different disorders effectively. The very important thing in Ayurveda or in Rasashastra, we not use these preparations as dietary supplements. But I think when we see some Ayurveda other preparations, especially herbal preparation, these preparation used. Most preparation used as dietary supplements also, but these rasa preparations we not use as dietary supplements. We'll see what are the challenges of Rasashastra, because it is very important, especially nowadays more people use rasa preparation. So that's why we have to see the challenges. What are the challenges? according to modern medicine, because we use the different metals, minerals, even mercury for our preparations. But in modern medicine, they raise many arguments regarding these preparations. We know, especially if we know process these preparations or these materials properly, there is a tendency to accumulate this preparation in the vital organ. We already know these things. Also, this if accumulate these materials in different organs, it can be create particular dangerous health risk to the human. So that's why we have to follow relevant processing techniques, methods when we are preparing this rasa preparation. If you not follow relevant processing techniques, sometimes we can create many dangerous hazards to the human body. So all these relevant processing techniques mentioned in our authentic Rasashastra texts. There is some arguments regarding the quality control and standardization regarding the Rasashastra bhashmas and rasa preparations, because these preparations sometimes we can see there is some lack of standard protocols. Therefore, to address the global requirement, it is an essential task to prepare quality standard rasa preparations for the global market. And also assure the safety of the mercurial and other or rasa preparation is another major issue in Rasashastra. Therefore, by doing different toxicity studies, even we can do acute toxicity studies, chronic toxicity studies, and even for genotoxicity, because when we use this mercurial preparation, modern science raise arguments regarding the genotoxicity. So we can proceed different toxicity study for assure the safety and efficacy of the relevant rasa preparations. Also, nowadays there are many research publications published in index journals related with different rasa preparation. If you go through some reputed journals and the reputed publications or the reputed articles, then you can see there are so many articles related with different rasa preparations. Especially these researchers related with characterization. Most of studies related to toxicity studies, clinical studies, and also physical chemical evaluation, development of standard operation for validation of this preparation, and especially sometimes most articles related with free radical scavenging activities and other antioxidant activities, and also disease-specific pharmacological activities, and some few comparative studies also there. Then I told actually according to Rasashastra, after completion of the Bhashmikaran or Man process, materials converted to Bhashma. Already I discussed, and these Bhashmas we can completely similar with the nano particles, and because these Bhashmas after Bhashmikaran process, these Bhashmas attain nano size, and can calculate the percentage of these nanoparticles also. That means after Bhashmikaran process, or in this Bhashma condition, material convert into solid form to non-solid form. Similarly, in modern science, by using chemical techniques, these ionic forms of metals convert into nano-sized particles. I think this method already practiced and used for therapeutic usage in Rasashastra. Now modern science also this processing this metal convert into nano-sized particles by using different chemical techniques. So when we see the metal usage, today metal usage, metal and some minerals used as biomedicine from ancient times. Generally, these metals usually used as dietary supplements to compensate the deficiencies. We already know. Sometimes different intoxication occurs due to unwanted exposure of mercury, arsenic, and iron-like materials. In such cases, we know chelating therapy prescribed. Yes, sometimes not only by using these drugs, sometimes by using some in food also. This in unwanted this intoxication can happen. So for this such cases, the treatment is chelation therapy. Last decade, most inorganic materials like gold, copper, and silver also are studied systematically to explore its anti-cancer effect. This then, other than this, sometimes the Vajra Bhashma mainly studied systematically to explore its anti-cancer effect, and also considering the metalloenzymic and metalloproteins, copper, iron, and zinc are main components of these enzymes and proteins. If you go through the structure of some enzymes and protein, you can see these are most enzymes combined with some metals like copper, iron, and zinc. These metals are the main components of that enzymes and proteins. Mercury and its relationship, we'll see in Rasashastra. We know mercury is the nuclear material. However, in the final Rasashastra, Rasaushadhi do not contain elemental form or inorganic or organic form mercury are there. So most of people raise arguments regarding this mercury, but we know we not produce our product with elemental form or ionic or organic form mercury. It is inorganic form. Is mostly used in the preparation, which is mercuric sulfide. We know Kajali, the black mercuric sulfide is the main or the basic form in most of the preparation. So metals, these most metals, minerals, and mercury used in inorganic compounds is well established and validated. Although in 19th century the medicinal value of mercury was revealed, there are some research to assure the efficacy and toxicity of mercury also. However, these research were unsuccessful because in this research they use mercury in inorganic form as well as chloride form, which proved dangerous. When mercury is used in the wrong manner, we know if mercury is, it can create DNA damage and it can create some these genetic deformities. So we have to prevent this such type of damage. Rasashastra explain different Shodhana and Samskara clearly. Nowadays, the demand for Ayurveda medicine, including this herbo mineral and mineral preparation in global market, is increasing day by day. Why? Most people know the awareness of side effects of Western medicine. Since the last decades, these preparations are prepared according to standard of world-class manufacturing, quality control, and validation. Therefore, users have more confidence and faith about this preparation because in Ayurveda drug preparation, they use different, I think the standard method and the preparation method all are these methods are very friendly manner in use for modern era. We will see what are the opportunities, especially it is very important to our undergraduate students. We will see what are the opportunities. All these rasa aushadhis, that means it may be a parvati kalpana or the pottery or the any preparation, we can divide into two. These preparations can be healthcare products or some preparations can personal care products. Then healthcare products mean we can use for any different disorders as pharmaceutical product or dietary supplement. And for personal care products, there are different oral care products, skin care products, hair care products, and perfumes. Likewise, there are so many personal care products used in now generation. Also, in current scenario, due to this COVID-19 pandemic situation, the immunoboosters are more in demand. Local or the foreign market, all people they waiting to get idea about this immunoboosters, and we know most of these rasa preparations having rasayan effect. Rasayan effect mean we can use these rasa preparations for using as we can use as immunoboosters because this rasa preparation directly address for the new situation, because people need and people request about the immunoboosters. I think among these most immunoboosters, rasa preparations having very first place, because already these preparations having rasayan effect. Other thing, Ayurveda cosmetics and the nutraceuticals and food supplements also having a good market. So that's why we in Ayurveda cosmetics, there are many cosmetics not prepared only by using these herbal materials. Most cosmetics used by prepare some mineral and the metallic materials also. Especially for sometimes we use some cosmetics to having fair skin. Especially we use some calcium containing materials like Sudha Varga. These materials we use for develop these cosmetic materials. Then actually it is need of the hour that sufficient number of graduates must be empowered with the sound knowledge of Ayurveda pharmaceutical along with analytical technique also. Not only the knowledge regarding the drug preparation, and they should know about the analytical techniques. Then they can reveal so which preparations can use for the pharmaceutical, for which preparations can use for the these cosmetics or the perfumes, or the as a logical preparation. Likewise, they can analyze the preparations accordingly. And we'll see. We have to see the career opportunities, because we have to see the what are the opportunities having for our undergraduate students. Ayurveda pharmaceuticals mean Rasashastra and Vaishajya Kalpana. It is one of major subjects for BMA students. These subjects deal with drug manufacturing and drug research, and sometimes new drug discovery, and also how the regulatory aspects related with this drug manufacturing process and the quality control aspects. All these things they studied under Rasashastra and Vaishajya Kalpana. So after completing this type of valuable course, to students, they are having so many opportunities. They can start their career with company with global Ayurvedic companies, and sometimes accepted global cosmetic companies, and even they can start their own drug manufacturing pharmacies for their as they are develop their career, and also offer good career opportunity in the field of production, not only for the production and also for new research. So I think today that's enough for the presentation. I think thank you for giving this opportunity to me to present this presentation in to our BMS, and also for the Indian and Nepal, Bangladesh students and to the physicians. And also I give my special thanks to the organizers, Weveda, CEO, and there are other company participants, and I give my thanks to BMA students and all the people who joined with this seminar. I think it's a valuable time to all of you to discuss this type of research. It is very need to today. I think to today, especially in this pandemic situation, what we can use, how we can use our Ayurvedic preparation for the generations, health generations. Thank you very much.
Thank you very much, Madam, for your informative explanations. And again, I would like to thank you, both of you, dear Sir and dear Madam, for the amazing and knowledgeable journey you carry us throughout these 2 hours on behalf of everyone. Thank you, everyone, for joining today's webinar. Good night, all.